Ever wake up and feel that nagging ache in your knee? Or maybe your wrist gets sore after a long day of typing. It's that all too familiar joint pain. We all get it, but have you ever stopped to wonder what's actually happening inside your body when your joints start screaming? Let's break it down. So first up, what even is a joint? Think of it as a sophisticated meeting point where two or more of your bones come together. We have different types, but the ones we usually complain about are the synovial joints, like your knees, hips, and shoulders. These are the all-stars of movement. Picture this. The ends of your bones are covered in a smooth, slippery cushion called cartilage. The whole joint is wrapped in a capsule, and inside that capsule is a special lubricant called synovial fluid. It's like natural engine oil, keeping everything moving smoothly without grinding. Ligaments and tendons are there too, like sturdy ropes and pulleys, connecting bone to bone and muscle to bone, providing stability. Okay, so when things go wrong, why does it hurt? The sensation of pain has a fancy name, nociception. You have tiny specialized nerve endings called nociceptors scattered all over your body, including in and around your joints. They're like little alarm systems. When they detect potential damage, like too much pressure, stretching, or chemical irritation, they fire off an electrical signal. This signal zips up your nerves through your spinal cord and straight to your brain, which then shouts, ouch. Something's wrong with the knee. A classic example is the soreness you feel after a tough workout. That's your nociceptors reacting to the buildup of lactic acid and micro tears in your muscles. What's wild is that our perception of this pain isn't fixed. It can be influenced by things like stress, which can make it feel worse, or distraction, which can make it feel less intense. Now let's talk about that angry, red-hot feeling, inflammation. Inflammation gets a bad rap, but acute inflammation is actually your body's heroic first responder. When your joint gets injured, say you sprain your ankle, your immune system sounds the alarm. It sends out a flood of chemical mediators like cytokines and histamine. This is what causes the classic signs. Blood vessels widen to bring in more healing cells, causing redness and heat. They also become a bit leaky, which leads us to our next point. This whole process is designed to clean up damaged cells and start the repair. The problem is when it doesn't switch off. Chronic inflammation, like in rheumatoid arthritis, is when the immune system mistakenly attacks your own joint tissues. It keeps releasing destructive enzymes that can slowly erode your cartilage and bone over time. And that leakiness I mentioned, that's what causes swelling. The medical term is edema. During inflammation, the walls of your blood vessels become more permeable, allowing fluid to seep out and accumulate in the surrounding tissue. This fluid buildup is what makes your joint look puffy and feel tight. This isn't just a cosmetic issue. The swelling physically stretches the joint capsule and can compress those sensitive nerves, adding another layer of pain. Think of bursitis in your shoulder from repetitive motion, or the intense swelling in your big toe during a gout attack, caused by sharp uric acid crystals triggering a massive inflammatory response. So what causes all this in the first place? The list is long. It can be simple overuse like runner's knee from pounding the pavement too hard. It can be the natural process of aging. As we get older, the cartilage in our joints loses some of its water-retaining molecules, becoming thinner and less resilient. Sometimes your genetics or an autoimmune condition are to blame. Even everyday life contributes. That persistent ache in your wrist could be from your office setup, and some people swear their joints can predict the weather, which might be linked to changes in barometric pressure affecting the fluid in their joints. So what can we do about it? For sudden acute injuries, the classic RIC method is your best friend. Rest, ice, compression, and elevation. Over-the-counter anti-inflammatory drugs like ibuprofen work by blocking chemicals called prostaglandins, which are key players in the pain and inflammation process. But for long-term joint health, one of the best things you can do is gentle, consistent movement. Exercise strengthens the muscles that support your joints, taking some of the load off them. Of course, if the pain is severe, doesn't go away, or comes with other symptoms like a fever, which could signal an infection, it is absolutely crucial to see a doctor. They can give you a proper diagnosis and a tailored treatment plan. Your joints are incredible pieces of natural engineering. Understanding how they work and why they hurt is the first step toward taking better care of them for a lifetime of movement.